What's the story about wisdom teeth, Dr. Lee? Why wisdom teeth and root canal? They're like, there's more horror story about that out than about anything else. Why is that? Tell us a little bit about it.
Most wisdom teeth that are taken out, they're taken out because they're impacted. So they're partially stuck inside the bone, so it requires more work to get them out, and the healing time is increased. So, patient might become swollen after treatment, they might be in pain for about a week or two. So it's not quite as much fun to take out a wisdom tooth than it is maybe something closer to the front of the mouth. That's probably really the big thing there. The more bone we have to take out, the more reaction you'll have after that.
Why do they call a wisdom tooth anyway in the first place?
Well, the wisdom tooth is going to kind of develop around, it might start erupting around the age of 17, 18. It's considered a time where people start to gain wisdom as they get a little bit older. So by the time that those teeth come out, the person's probably a little bit wiser, so they kind of call those the wisdom teeth.
Well, I surely mustn't have had a wisdom tooth because I surely did not get wise around 17. Not so sure I got it by now, but 17 surely wasn't my wise time. Why is it that the body is constructed that there is this type of almost looks like a useless thing which just is nothing but bothersome in most cases? Why does it grow that way? Is something going wrong there or what?
Well, long time, as evolution happens, your jaw starts to get a little bit smaller because, your skull's going smaller. You don't need to have those big teeth to kind of chew with. So that's one reason why you might not have enough room to get your wisdom teeth in. The other thing is, our diet's a lot more refined. We cook everything, so we tend to get less wear in our teeth. So if we had a really coarse diet where we had to really chew on our food a lot, what would happen is, all your teeth would start to rub in between, and you get that wear between there. So essentially, the teeth they get closer and closer together, and you'll have more room in your back teeth for the wisdom teeth to actually come out. But since our diet is, we cook everything, it doesn't require a lot of force to chew, our teeth are actually a lot more rounder in between, and they've maintained the width of what they should be. So now we don't have enough room for the wisdom teeth to come out. Actually, they did a study in Australia where they took Aboriginal people, and they found that all those people had enough room for all their wisdom teeth. But their counterparts in the city, they all had crowded wisdom teeth. They had impacted wisdom teeth. Now, they took those Aboriginal people, of course, they started moving into the cities, and after about a generation, they saw that those people are starting to get crowded wisdom teeth. What happened? Well, those people who live, the Aborigines, they had a coarser diet. They don't sit there and cook all their food. They tear them apart, a lot more force, a lot more wear between their teeth. So they've had enough room in the back of their mouth for the wisdom teeth to come out. But the people in the city, now they're starting to cook their food, and they don't get that wear, and their teeth are more whole. So now they have impacted wisdom teeth. So a lot of it's societal. We cook our food now, so now because of that, we don't have room for our wisdom teeth.
Right, interesting. Now, with all this drama which goes around the wisdom tooth, in today's technology, yes, it's still, you mentioned, difficult to go all the way in the back and pull one out, but a person probably gets nicely knocked out, so while the operation is going on, he really doesn't feel anything, right? Or not some, whatever. So shed a little light on it, and then thereafter, can a person go back to school or to work, let's say the next day, or and will the medicine get him over until it's all done? Basically, do we have to be afraid of being in pain for a long time now, crucially? Yes or no?
Well, some patients will be able to go ahead and go back to work the next day or so, but most of our patients want to give themselves at least a day to kind of simmer down. We don't want you to engage.
So maybe do it on a Friday. Or on a Thursday, Friday, so you have a whole weekend to basically relax a little bit.
Yeah, we don't want you to really engage in a lot of physical activity or be out in the sun too long. Definitely stay hydrated for at least a couple of days. everyone's a little bit different. Some patients are fine and they go on with their lives. Some people are in a little bit more pain, and it's just their immune response is a lot more heightened. For us, in my practice, the majority, we don't do sedation here. All our patients just get just a local anesthetic, just the numbing in the gums, and we get the wisdom teeth out comfortably for them. So at least when we're done here, they just walk up and they're finished.
Okay.
But yeah.
And then you give them medicine to get them over the next few days of pain.
Yeah. And we definitely give them medication.
Right. I've heard that some people don't take their medicine. They take it when the pain comes, not the way the doctor says, every hour or whatever. And then by the time the pain comes, until the medicines kind of starts working, they are in way more pain than they would be if they would have taken the medicine very, very much the way the doctor said. Is there some truth to that? Does that, happen? Patients non-compliant with your orders?
Well, the majority of patients are, they might not take their antibiotics as prescribed, but we don't really see a lot of patients coming back with infections, which is good. It's actually, it's been years since I've seen anyone come back with any infection. Unless your immune system is really compromised or you had a real big infection to begin with, most patients heal okay. And for our patients, we usually have them take an anti-inflammatory medication before they even leave our office. So when everything wears off, the body is not starting to cause that inflammation right away. And we give them instructions. Those anti-inflammatory medications are probably more important than those narcotics like Vicodin or something, because those don't do anything to help make sure that they're not quite as swollen later. So, we try to take great pains to make sure our patients are taken care of as best as possible. Just like how I want to treat my dad. If I told him, I don't want you swollen for the next few days or something, so I want you to do this and this and this. Now, it's really important for our patients to follow our instructions because we only do it because we care. If we didn't care, we'd say move on and we'll see you later. But we really do care about our patients and how they heal.
Sure. So following doctor's orders still has some meaning and we should still do it, right?
Yeah, definitely.
Okay, thank you very much, Dr. Lee.